Dr. Chris Nelson here today, and today's topic for Tuesday is revisions. What is a revision? So, this term I learned professionally from Dr. Kyle Stanley, who lectured to the Seattle Study Club at one of our big events. And he was up on the big stage and he was talking about the dark side of dentistry and how mental health issues with dentists and that sort of thing. You guys have all heard about that stuff, but some of the focus that he talked about is the intense nature of addressing redos or repairs, or in this case, what we're calling a revision. So I really liked what he had to say, and I liked the term revision because it's a medical term, and so we started using that. So we expect perfection in our career, right? As dentists, we want things to go perfect. You want things to go perfect. We both want to have whatever I do for you on your behalf be in there forever and look perfect and have no issues, right? So a lot of times that is the case. Things go really well, they last a super long time, and everything's great. But sometimes things have to be redone. The analogy that I like to tell you is a medical doctor analogy. So if you were going in for a knee surgery and that knee surgery had some complication, the surgery was done, you think everything's fine, but there was some issue afterwards. Would they redo that? So sometimes revisions happen, but you get what I'm describing is that sometimes something is performed and performed well by skilled people and then has some post-operative issues that need to be addressed inside of a revision. Well, in our practice, I am looking for long-term relationships with patients where we have shared interests, where your work, the work that I do for you, it lasts a long time. So I want to do what is right for the relationship to have it be a long-term relationship. I also try to have very clear communication about how long things should last. But even then, life happens. So sometimes there's an additional cost for the patient. Sometimes there's an additional cost for me. Sometimes we share in that cost. Sometimes the patient has a larger proportion of that sharing, and sometimes I do. It's very case by case. But my commitment to our patients is that we do our best to have very clear communication regarding the situation and how we can best handle that. So I know the term "it depends" gets used a lot, but really in these cases, it really does depend on the specific scenario. The main thing is, our interests are aligned, and I want all of my patients to have a good experience. One of our core values is positive patient experiences. So we also employ a wonderful financial coordinator. Christy takes care of our financial scenarios, so she can help make things work for people, because that's always a factor, is how much does something cost, and especially when it's a revision. So I hope that this little conversation has given you a little bit of insight into how we address revisions. And there's some subtlety involved, as you're seeing. And also, I guess one last point is, there's some subtlety involved in whether or not our office performed the work, or if it's another practice that performed the work. Because sometimes I get it, patients have had work done that was expensive work, and they come to our office for a second or third or fourth opinion regarding that work, and then they get to hear how much it might cost to revise that work that we didn't perform, and sometimes that can cost even more to have work done elsewhere revised by our practice. So that's a delicate situation, and we do our very best as much as possible through those conversations. So if you have any questions about that, you can reach out to us through our website, and YouTube comments, of course, but if it's something more specific, obviously, like send us an email. And if you're one of our existing patients watching this, communication is key. I always tell people I want to be the second or maybe third person that knows if you have an issue. So, maybe you're the first person and then your spouse or significant other is the second person. But I want to be right up there in the priority list of, hey, what can we do? Because I want to be a problem solver for you and for your situation. If you haven't seen it, I have a whole video about I'm not your hero and I'm not your villain. And it kind of talks about how, I want to be a problem solver for you and for your scenario. So I hope that makes sense. And I hope that in some way, we added some clarity to a challenging situation, that's for sure. So I hope you have a great day and go be nice to somebody, smile for them, make them feel better because of your smile. And I will catch you on the next video. Take care.